I'm so sorry that I couldn't be with you today. I had a conflict and had to be in Ann Arbor today. But I did want to participate at least by video because I think that what Lazet Pelzer is doing with this exercise, health, and wellness symposium is really great. I just want to tell you that I've been involved with trying to have a healthy lifestyle now for basically my entire life, and it's really not that hard. I mean, there are a couple of basic things to think about. First of all, it's exercise. If you belong to a gym, that's great. Go and use your gym membership and make use of that. But you don't have to necessarily belong to a gym. Over this past year and a half, most of the gyms have been closed. The Mort Harris Fitness Center, where I usually work out, has just been open intermittently. But I've done a lot of walking. I've done a lot more cycling. There are just other things that can be done. The important thing is that you stay physically active. You stay active at least a half hour a day. If you can do more, do more. So physical activity, I think, is very important. And if you do it all the time, like I do, it just becomes a part of your daily living. And when I don't exercise, I don't feel as good. And when I exercise, not only do I feel better, but I think I make better decisions. And there actually has been some research that shows that exercise helps with decision making. So that is one thing to think about. Diet obviously is another important variable. People oftentimes do these yo-yo diets. They get really motivated and go on a very strict diet. Strict diets are very hard to maintain. So you don't have to try to go overboard on what you eat. Just do certain things in moderation, which actually is not that difficult. For example, it might be hard to cut out all foods with sugar and salt or saturated fat, but you can certainly cut out some, particularly the sugar part. If you drink coffee, start cutting back on the amount of sugar you put in your coffee. Avoid processed foods. That one is a little difficult because so many foods are processed, but there are a lot of little things that could be done. For example, I typically don't eat anything that's white. I don't eat white bread. I don't eat white rice. I substitute brown rice, for example, and I substitute multi-grain bread. I'm still having bread, and in fact, I think multi-grain bread tastes better than white bread. But it's also a little bit healthier. Incorporate as much vegetables as you can. I'm not a big fruit and vegetable eater, but I do try to incorporate as much vegetables as I can. I personally don't eat red meat, but that is just something that has happened not for any religious reasons or anything else. It just the story behind it, I'll just tell you, is that I guess it was 1985 to 86, I lived on the island of St. Lucia. I was in charge of eye care services on the island, St. Lucia in the Caribbean. And now it's a big tourist destination, but it wasn't back then. And I couldn't get access to good meats. And so I had someone a local person who cleaned for me and cooked for me, and she would go to the market every day and have fresh fish from the market every day. And so for a year, I didn't have access to red meat. I did have some chicken, but mainly it was fish. And a lot of the patients, they were fishermen, and they gave me fish rather than payment. So I had a lot of fish that year. When I finished and came back to the States, of course, first thing I did was go get a nice big fat steak, and my stomach just didn't feel right. I couldn't process it, and so I couldn't finish the steak. Didn't think much about it, and then I tried again a few times, actually, maybe 3 or 4 times, and each time I realized that since I hadn't had it for such a long time, that I was actually having trouble digesting this. So I finally said, why am I making such an effort to try to eat steak again when obviously my body is telling me that it's rejecting it. And so I just stopped. So I haven't had really red meat since 1987 maybe, and I've been just fine. So you don't have to necessarily go to the level that I did. I just didn't have access to it. But I will tell you that limiting the amount of red meat you eat would be good for you. I incorporate more fish. Chicken is better than red meat, and you can incorporate more chicken. But the main thing is fish and vegetables. And then the other thing is that you don't have to necessarily give up alcohol. I drink. I love wine, and so I have a couple of glasses of wine almost every day. But I drink in moderation, and in fact, a couple of glasses of wine is is probably healthy. And so I tell you a story. A while back, I went for a physical, and this was maybe 20 years ago. So I went for a physical, and I asked my doctor, is there anything else I could be doing that I'm not doing? He said, well, you can incorporate a little bit more red wine into your diet. So I took that to heart, and so I drink red wine. So you don't have to give up alcohol. So again, it's just a matter of moderation. Make sure you get your physical every year. And not only that, but know your numbers. Yeah, you can just go to the local drugstore and get a portable blood pressure monitor and take it periodically. They're pretty accurate. I take mine every morning, and there's been times when I have noted that my blood pressure is high, and I've been able to catch it and been able to intervene in some way. And so that's pretty easy to do. Weight, keep track of your weight. Obesity is a major a risk factor for a lot of things. And so you want to keep track of your weight. I have a scale in my bathroom, and I get on it. When I see that I'm fluctuating to a level that I don't like to see, I again intervene in some way. Maybe I do burn a little bit more calories, or eat a little bit less, or something. But keep track. These are just very important healthy habits to keep at any time of life, but I think it's particularly important in the midst of the pandemic. Again, just thinking about the pandemic, just remember that those with chronic diseases like hypertension and diabetes, or as I mentioned, obesity, were at greater risk for having a bad outcome from COVID-19, even in terms of dying. And additionally, blacks continue to suffer disproportionately from COVID-19. There was one of the things that I was so pleased about was the fact that the disparity in the COVID-19, both morbidity and mortality, had been completely eradicated during the summer. You might remember that probably in March or so, the blacks were really having a disproportionate burden from the disease. In fact, in terms of deaths from COVID-19, is about 45% of COVID-19 deaths were in the black population here in Michigan, whereas we make up only about 13% of the population overall. By around June or July, that had completely reversed, and blacks were actually doing better than whites at that time. Now, with COVID-19 ramping back up again over particularly in April, most of that gains has been begun to be erased, and blacks are again having. It's not the same as it was last year, in March, but it's again getting to the point where we are suffering disproportionately. About 19% of the deaths right now are from COVID-19 are in the Black population. A lot of that is due to the fact that we're not getting vaccinated at the same rate as other populations. Right now, particularly in Detroit, only about 33% of the population is vaccinated, whereas statewide it's closer to about 55%. And we cannot afford to have the gains that we've made totally erased. That's one of the major news stories of the year, was the fact that the disproportionate impact of COVID-19 have been erased in the Black population. And I'm so proud of that fact that we've been able to do that, and to go back to a situation like it was last year in March is just untenable. So please, get your vaccinations. I'm a scientist, I'm a physician, I'm an epidemiologist. I've been involved with these vaccines. I was on the FDA advisory panel for 12 years previously. I know what it takes to approve new medications and new vaccines, and I'm telling you, it's safe and doesn't make a difference which one of the vaccines. The best vaccine is the one in your arm. So please do what you have to do to go get vaccinated. I understand, obviously, that there's real hesitancy, particularly in the African American population. But as I said, it really is safe. I know the scientists at the NIH who have been involved. One of them is actually an African American woman, one of the lead scientists in the vaccine development. So you can feel comfortable that there's been good representation of African Americans, both in the development of the vaccine as well as the approval of the vaccine. Let me talk a little bit about prostate cancer. Other than skin cancer, prostate cancer is the most common cancer in American men, and it's particularly prominent in African American men. American Cancer Society estimates for prostate cancer in the United States for 2021 that there's about 249,000 new cases of prostate cancer every year, and about over 34,000 deaths result from prostate cancer. Amazingly, about 1 in 8 men will be diagnosed with prostate cancer in their lifetime. So it's not something that's trivial, particularly in African American men. About 6 cases in 10 are diagnosed in men who are 65 or older. It's pretty rare if you're under 40 years old, but if you're older, you have a very high chance of being diagnosed with prostate cancer. So certainly yearly screenings, I think, are very important. There was a time, probably about 10 years ago or so, when there was a little bit of controversy about the value of screening for prostate cancer. And the reason for that was that there's a lot of prostate cancer that does not go on to cause major problems. On autopsy, we see that a lot of people who didn't even know they had prostate cancer, had prostate cancer, and it didn't affect their life. And so a lot of people is thinking that you really don't need to be screened for it. But the problem is, I do know a lot of men who did not get screened for prostate cancer, and when they finally went into the doctor, it was too late. The cancer had metastasized, and once it does that, it's very difficult to treat it, and so it's just not worth it. It's a simple test. It's called the PSA. It can tell you if it's elevated, the chances of having prostate cancer are very high, and it's very, very simple. And so if you're older, you should definitely get it. And even if you're younger, if you have risk factors, the more risk factors you have, the younger ages should be also checked. And by risk factors, the main one is if you have others in your family, your father, older brother, just whatever, who've been diagnosed with prostate cancer, then the chances are much higher for you. And so you should probably get checked even with your 45 or even as young as 40. Be checked with the PSA test. But certainly anyone over age 50 should start getting routine checks for prostate cancer. I'm talking, of course, about men. Okay, cardiovascular health. Cardiovascular health is serious. It's the number one killer for all Americans. And stroke is also a leading cause of death. And as frightening as those statistics are, the risk of getting those diseases are even higher for African Americans. In 2018, African Americans were 30% more likely to die from heart disease than non-Hispanic whites. And although African Americans are 40% more likely to have high blood pressure, they are less likely than whites to have their blood pressure under control. There are several risk factors for heart disease. I mentioned one of them before, obesity. High cholesterol is another one. Hypertension, diabetes, and smoking are the common risk factors. The best prevention, though, for heart disease is something we talked about from the beginning, is exercise and a healthy diet. So again, these are all lifestyle kind changes that you should try to incorporate into your life. And some people may require some medication also, but many people, if through good diet and through a lot of exercise, can lead a healthy life and not succumb to cardiovascular disease. So, let me just end there. I want to thank Lazet for inviting me to speak to you today. Again, I wish I could be there. This is a topic that I do care a lot about. Please continue to try to lead a healthy lifestyle. And if you haven't been vaccinated yet, please go get vaccinated. If there's one thing that this pandemic has taught us, it's the importance of taking care of ourselves. So do that, please. Thank you very much. It's been great being with you, albeit virtually. Thank you.